Tonight we've got a great show for you. We're talking about injectable fillers and Botox. We've got...
Hey, how do we know it's going to be a great show, though? Let's talk about that. How do you know?
Because we haven't had it yet?
That's right, it's going to be good.
Well, I probably always say it's going to be a great show.
You do, and it always is.
You have doubts.
No, I have faith.
I don't have doubts. Well, Andrea Fairman, our injectables expert. In fact, Andrea has been doing injectables for well more than a decade and is a licensed cosmetologist in the state of Colorado. She's going to be talking about our treatments tonight and doing treatments. We're doing, what treatments are you going to perform tonight?
We're going to do demonstration on the lucky demo here. We're doing Botox, and then we're going to do a demonstration for Kybella, which is an injectable treatment for submental fullness.
Okay, so injectables for Botox. Is that a filler?
It is not a filler, sir. It is what we like to call Brotox for you.
Okay.
And it's going to help us to relax some expression lines that we don't really want to see, but still keeping a natural masculine appearance, and it's going to look great.
So Botox and injectable fillers. Okay. Yes. And also we've got Stephanie here with us. Stephanie is our patient coordinator for ancillary services. So that definitely covers our most popular injectables, Botox, and the fillers.
Yep. Yes.
Who is this for? Is this just for old people that have bad wrinkles and saggy tissues?
No, actually, it can be, but there's a lot of patients that are candidates even long before they start to really feel like their skin's in bad condition. So patients who have unwanted lines of expressions are going to be ideal Botox candidates. We like to call it preventative maintenance, and starting very, very conservative early on is going to help with, keeping a natural appearance.
So for someone as young as Stephanie, where does something like a filler or Botox fit in for you?
Okay, so for Stephanie, and I'll just use you as a beautiful example,
Please.
You need nothing, but
Right.
if she came in and said, I have some concerns with these deep lines in between my brows, I don't really like it, what can I do? When I relax, you don't see them, but when I'm really concentrating, I have these deep lines. Well, a little bit of Botox just placed kind of right in between here in these strongest muscles will help to relax it. It's going to help to open up the eye, and it's just going to kind of soften the appearance a little bit. So for fillers, most commonly when patients are younger, they like the fuller pout. That seems to be pretty popular these days. So a little bit of Juvederm in the lips around the mouth can...
Lips are definitely popular.
They're very popular.
Okay. How recently have you been treated? In what areas have you had Botox used?
So usually it lasts about average
3 months.
Filler, it all depends on the patient, depends on the area that we're doing and the look that they're going for, the kind of look they're trying to achieve. So it's really patient specific. At least that's how we always really want to start. But I always say let's start conservative, and then let's have you come back in 2 weeks if needed.
And for someone like me that may be a little bit older, that has powerful frown muscles as a man, that would probably be a pretty good treatment. For someone young like Stephanie, if you go in with 25 units right away and flood the whole glabella area, you will freeze them. Now, some people may like that and say ultimately they may get there and say that's the look that I like. But for others, it's going to freak them out. So a patient comes to me, comes to Andrea and says, you know what, I'm starting to get actual lines in my skin. What can we do about that? Can you put a little filler in there? Oftentimes filler may be a good option, but we're always going to recommend relaxing the muscle with Botox as part of any treatment like that. Because otherwise, a powerful muscle is just going to immediately beat up on that filler. The filler really won't last.
Absolutely.
And then the experience we have is that if we do keep that treated with Botox, relax the muscles, with or without using a filler, over time it often will give improvement, but it may take a year or so in those fixed lines that we can have. So that's someone maybe in my age group, middle age, that shows some signs of facial aging.
Maybe they didn't wear sunscreen all the time.
Maybe they didn't wear sunscreen all the time.
So.
Yeah, those things, those innocent mistakes,
Those
right?
innocent mistakes. It is a medication, so it takes time to work. It's not this instant gratification like, a lot of fillers can be. Fillers are great from kind of the cheeks down.
It's pretty instant, though. It's really within a week.
Within a week, you definitely see that result.
Yeah.
And people love it because it's just like, they can plan ahead and look great for a reunion or a wedding or, just anything coming up, and it's relatively quick. So the ones here kind of in between the brow, we call that glabella area. Those are called your corrugators and your procerus muscles most commonly. Then you have your frontalis. It's going to lift the forehead. Those are very important. Those elevate the eyebrows, so we always want to treat that muscle really, really well, so we don't overdo it. And then we have this auricularis oculi muscle that does create the deep lines when we do the little squinty smile.
Yep.
So cute. So that's the most common area, you know, and then again, like you said, we do off-label, use it in other areas. Some of my patients love it when we do these depressor muscles down here with just a tiny little amount. It just softens that little jaw line and the marionettes. So it's really, really nice.
And even 1 or 2 units on lips can be helpful for some lip lines.
It can soften those too. It's great.
You touched on bruising, and we do have suggestions, basically requirements for preparing for a procedure like this. What are those?
So you want, if possible, if you've got some time, try to cut back on any NSAIDs. So your ibuprofen, your naproxen, your alcohol. That's another one that's, try to go easy on that. So anything that's going to thin the blood, it can make you bleed a little bit more. We know this, you know, when we prep patients for surgery, very important. So it's same with any sort of needle going into the skin. You know, you run that risk of having some bleeding. So anything we can do ahead of time to minimize it.
That pineapple is a secret food, right? It heals the body.
It can. It's beneficial. I like to tell my patients to use that or to eat fresh pineapple after they do any kind of injections, because it's the bromelain in the fresh fruit can be really helpful to help the inflammation and help the healing process. So people like to hear that. It's great. I mean, if you like pineapple.
So even though it lasts to where you may notice it, you know what, I think it's kind of going away. It's not gone. You still have some amount of that correction still there.
Usually, yep.
Yeah. And talk about the nose, or you want me to talk about the nose?
You talk about the nose, Doc. You're the nose guy.
So we'll definitely use filler for non-surgical rhinoplasty. And what we're talking about there is where anywhere we're adding can give an improved appearance to the nose. A classic would be if it looks like you got a bump on the back of your nose, but really it's a significant depression up at the starting point or the root of the nose here. That's a relatively straightforward thing for me to fill with a filler. I will start with a hyaluronic acid based filler, potentially move to something over time if we really like that and it goes away, which is rare because just like my cheek took a couple years and I still don't notice a difference. I tend to find the same things, particularly when you use filler in the nose, because filler in the nose, there's not as much movement. It doesn't get beat up as much from the physical movement in the tissues, and it tends to last a long time. Okay, you want to move on to Kybella first and talk about Kybella and then do treatments?
Yeah, we can definitely do that. So Kybella is an injectable. Now you have experience with Kybella. It's been around for many years, but it's recently now on the market as Kybella. But it's an injectable medication that literally just dissolves the little pocket of fat under the chin. So the double chin people don't like. Oh, I don't know if you guys can see the patient here. We have this little grid mark on her. She's got some topical numbing cream on. She's got this little pocket, and this is where we see the ideal candidate for Kybella. She's just got this little pocket that drives her crazy. So what we're gonna do is add the product right here, and over time we're gonna see this decrease, and we're hoping to get a little bit more definition of her jawline. So let's get started. And it is temporary, but it's really the first 20 to 30 minutes of being in the office that they're I feel
the heat wave.
There's the heat wave. So
yeah, not bad though, not horrible.
Not horrible, but to be expected. And honestly, we want to see that, so it's a good sign. And then that's it. Into the muscle. 1, 2, 3. Poke.
Are you doing it?
I sure am.
All right. Thank you very much. Enjoy your journey. Good night.